Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to do the second phase of this slicing technique that we've shown the other video. In the the first phase of it, where we operated on the deciduous cuspids, both upper and lower, on both sides, of course, and you can see what we did in this part of the video. And here we're going back to the second deciduous molar to make space for the cuspid and the second bicuspid coming in. Excuse me. Okay, let's get started with this. I'm going to have to touch that a little bit, and here we go. Now, we have done this portion of this earlier by reducing the deciduous cuspids. These are permanent cuspids now that are trying to get into the rest of the space. Now, we have not touched this case other than providing space. This is where the tongue put these teeth and hit this position, and the lip structure catches it out here, and that's where those teeth ought to be, regardless of whatever diagnostic method you may use, and it may tell you where to put the lower anterior teeth. This is where the body actually put the teeth, and that's where we want to try to keep them there. We're going in here, we're helping nature by working on the spacing, and we're letting nature do the orthodontic movement of the teeth. And it doesn't always work out absolutely perfect, and a lot of people don't come back. Now, this particular young lady, I don't think ever came back, except she got off and married, and she had a little girl, and she brought her back to me to do the same thing, so she wouldn't have to wear the braces. So what we're going to do here is come in, and we look on our Panorex, and you can see the cuspid, the high size of it, and the space it's going to need to get into this area, and we're going to take that much space off of the second deciduous molar. Just now, if the molar is there, set there, teeth kind of sprawl out, like this, and we're going to come in and take this off like that, and the bicuspid will come up and just fit right into that spot right there, and we'll still have room enough in here for the second bicuspid to erupt into the space. And you can look at your Panorex and mark them. I don't have that marked on here, but that's the way we figure out how much space we're going to have to use there. Let's go ahead to the next deal, and I'll show you. Okay, when you get ready to do this, either the cuspid is still, the deciduous cuspid is still there. In this particular case, the first deciduous deciduous molar was ready to go, so we just flip it out, and now we're going to come in and take the long diamond and cut this tooth off and come out and still leave a portion of this root underneath there. You can watch this go, if you will, here, and that's exactly what we do. And then we pack the zinc oxide and eugenol in that tooth and leave it alone. And let's go to the next one. Here we've taken this long diamond, and we're going in and we're cutting this side of that tooth off. In other words, the crown is kind of like that, the teeth roots going out, and we're going to come down and cut this off and kind of go along like that and leave part of the root in there. The bicuspid will eat this away. It's the root structure. As it comes in, it will set right in this area, and just watch that take place. Now we cut the tooth off and take that and go down and take part down into the root. You cannot put a rubber dam on there and do this. You're going to grind into it. Now this burr that is in here I don't show, but it is a long round burr, about a number 4 down here at the end, and you can go right in this side of this tooth and just remove this tooth, and you kind of go down in that nerve canal and go through over the hump, and you go down in this one a little bit over there, and you're going to make an opening. You're going to remove the nerve from this deciduous molar tooth, and we do this by infiltrating all around. We don't block the whole jaw to do this. We just infiltrate there. Now we'll take that burr and go into that area just like that. And we've opened it up, and now we've got a kind of a hollowed spot in that tooth. If I show this crown again, you're going to shoot me, but we just go in here and kind of grind this part down and jump over and get this out of there. And now we've got an opening in here. This whole thing is kind of clear, and we pack that with zinc oxide and eugenol, and it will go down in the nerve canals to some extent. And then you're through with that tooth. Now I know I've done over 1,000 of these things, and I have never had one of them blow up. But we always do it on sound tooth. We don't go in and do an abscess tooth. Now the tooth can have a cavity in it, but as long as it's still solid and it's not infected, we go ahead and do it. But if they get infected and the infection's down on the roots, I do not do this. It doesn't work out. So we clean that out good, and we come out and don't try to get the blood out of there. Let it fill up with blood. It doesn't matter. Now we've shown you how to pack this zinc oxide and eugenol. You just put a little pile of it up, put a few drops of eugenol, and you mix that stuff till it's so thick, and then you blot it out with your thumb or cloth or something to go in there and get the excess eugenol off. You take a spoon, just a big spoon like that, cut out, and now we'll end up with that piece of this zinc oxide and eugenol on the end of the spoon. You take that and just let it bleed. Don't worry about the bleeding. Don't worry about the not having a rubber dam on you. You're not going to do anything. You've taken a sterile burr as clean as you can get it. I use a brand new burr every time we do these things, and we put them in the liquid sterilization and take them out, and then put this in there and let it bleed. There's nothing wrong there. Now just take this zinc oxide and eugenol on that spoon, and now I'm just going to shove that up in that tooth, and it'll go in there, and the tooth will, when you get through with it, it'll be full of zinc oxide, and a lot of times they'll have a little neck like that go down. And now the resorptive procedure in here will just leave you a little enamel coating like that. And then I'll show you a tooth later on in another deal where we've done that. And we're going to pack that in there, and we pack it hard. And I don't think I'll show it here, but I'll take an amalgam plugger and push that in there. And now put some more of it on top of it and smooth this out, smooth the edges of this so they don't cut themselves. And now we have looked already, we've seen that the bicuspid is coming up here with a crown. I mean, it'll come up something like this, and the cuspid has room enough, and it's already coming in here, and that crown of that bicuspid will just fit right up into that space. Now this is a blank spot. Here's the little girl that we did that second phase. I have a picture of her before we started. Now this takes a few years. You have to put this at a certain time when they're coming in, and you can look at her eyes and tell that's the same girl, and she's not too thrilled with me back here, but she's the one who got married and brought her daughter back to have her teeth done so she wouldn't need to wear braces. Now, I'm nothing against wearing braces, but a lot of times we have to finish them off like that. Now, this is a little later on down in the line. I don't have a date on that picture, but these are the teeth that we brought in first. And if you go back to that video, and you can see how crooked they were when we started, and now the body or nature, or whatever you want to call it, the function of the teeth, the tongue pushed these teeth to this point, and the lips held them back from this point right here, and that is the correct place for those teeth to go. I don't give a hoot whose diagnostic situation or things that you're using now. They cannot tell you, looking at that x-ray or whatever they look at, to come up with the position of these lower anterior and upper anterior teeth. But when the body puts them there, and that's the way that force is. They have to have a patient that is not sucking their thumb or tongue thrusting or doing other things. If you have somebody that's normally breathing, they don't have any allergies, and everything else is working out right, the body will move the teeth into the space if you just give them space enough to do that. And I know they would not end up that way if you left them like they had to fight their way in like that. Now let's go on to the next deal. And you see these that we just worked on the last video. If you want to look, see that lateral pull right up in there behind that, and same thing over here. This lateral, let's see, they got the central, the lateral pull right up in here. And the midline was old. I'll show you that. You see that this was not on to start with, but they pulled them in place and the midline was on. All right, now we cut the deciduous cuspid here. Either it comes out or the first deciduous molar comes out at the same. When one of them goes, take the other one, and now we're going to take away from the second deciduous molar the space that we need to get the bicuspid and the cuspid in place. All right, here it is on the upper now, and one of these teeth will go, and when the one goes, then you take the other one, and now you come over and reduce this deciduous, what it needs to come in, and you look at your panorex, and you can get a pretty accurate view, whatever's, and you can tell how much space you need to take out here. But if you've got the nerve out and you didn't get quite enough, you can come back, take it out. This tooth has no feeling, doesn't give you any trouble, and I've done so many of them that, and I've lectured to the heads of pediatric departments, and they'll all want to put something else in there. You don't need anything but just zinc oxide and eugenol, and have it patted out till it's almost as thick as amalgam, and you plug it in that hole over there. So let me go. Here we go. We've cut this tooth down now. The cuspid came in, and now the bicuspid is right there where we took that. It comes up in there and moves over, and it may eat away part of the root, the meso root, and we've got plenty of room here for our second bicuspid to come in. I don't think I showed this after that got in there. But now, look where these teeth are. You saw those cuspids coming in back behind here. Now they're up here. I don't know where the bicuspid will come in. Now, it won't rotate them good, but if they're lined up pretty good, they'll come right up into that space. And now, I haven't put a thing in there to move the teeth. I let nature do it. And I've lectured on this all over the country and for 40 years or more. And there's very few people do it. But you can do this. You may have a problem figuring out how to charge somebody, but you look at it at the time it needs to be done. You line up the 4 adherers. Then when they get down the line, you come in and you have to do this second phase of this. And there are 8 teeth that you take the nerve out of. And it works. That's all I can say. I don't have any double-blind study. I don't think it's possible to do that. But I've published a paper on it. You can probably find it and put it in the Texas Dental Journal. It was years ago. And we've done this for, I don't know, at least 40 years. And I think we've been doing, I did this several years before I actually went into nothing but orthodontics. All right, let's go to the next and see what happens here. And this is the upper teeth. The upper cuspids are coming in now, and you'll have to make space for them. Now on the lower, look where this bicuspid came in. Now I haven't touched this thing. The tongue shoved it up here, the lips caught it over here, tongue shoved it in there, and that's better than any diagnostic method you have to find out where you ought to put these teeth. I don't care what Tweed said, you put them 90 degrees, you don't just forget about that. I mean, let the body put them where the body wants them. And it'll be where the pressure in here is equal to the pressure out here. And the teeth take in, and if they're out of line and one's out there, it'll shove it up in position. Now this tooth is not perfect, but it'll get a little better later on. It'll have a little extra tongue pressure. We'll gradually push that in place. Or if they come back and you don't want to, we get them back and do a second phase where we put brackets on there and straighten everything up ideal. Now many of them, like this little young lady, brought her own child in to do that so they wouldn't have to wear braces. We don't promise them that at all. Now this bicuspid will come in and the tongue will push it, the lip will hold it, and that tooth will line right up in that space like that. Okay, here's the permanent cuspid, so we have to get in here pretty early and get this thing out and get this one out, and we're going to reduce this one over here and get this to come on down like that. And here we've got a little lateral out of space. The lip will catch it here, the tongue will push more on that tooth right there. All right, let's see where we were. All right, here on this side, the same thing. The cuspid has no room up there for that this time, and so we look at it here. We're going to extract the deciduous cuspid, and we'll take the, now this is a bicuspid coming in here, so we're kind of late getting to it. So we're going to cut this off right here. This will move up into this area, and the cuspid will have room to come in. We could have gone in earlier. You watch that bicuspid. As soon as it gets in there, then do the, or starts in there, take the other tooth out, so you'll have this ready for this tooth, and it'll move it right over into this spot. Now this is the lower, and you see where these have come in. Now this bicuspid's got a little bit of turn to it. We don't have room. We can't make a round tooth turn flat. And we've got ample room, and what this doesn't do, the 6-year molar can come up in there and move it and go into a class 1 relationship. Let me see if we got another picture here. All right, that's a good shot. Now this lined up like this, there's never been a bracket or band or anything on it. The tongue shoved these teeth where it is. The lip caught it over here, and the teeth end up where the pressure is the same right there. And I don't care who diagnostic method that tells you to put them somewhere. This is where the body put those teeth. And when this goes, this second bicuspid will come right up in this area right like this and fill that space. And then what it has left over, this will drift forward into that space. I don't think I have a picture here for you on that. But anyway, that's where it'll go. And you see whether this lateral, you remember where it was? This cuspid was erupting lingually. It's shoved up in place. By this tongue right here has more force than you think it does. It will shove teeth all over the place. Now here, we're looking at it from the side. That's again the same way. And there's going to be room enough now for this other bicuspid to come up into this space. It'll come right up against that tooth. These 6-year molars coming through there. And here is the young lady. After we finished, she came, we check them, and then we just, if I remember correctly, we did not do the second phase of it. We just left it. There's a few flaws, like that lateral is not perfect right there, but it's not in a bad situation. Now I did a missionary, the doctor in the mission field's daughter. We did similar things. I think it was serial extraction, and they didn't come in perfect, but they came in looking good. And then later on, they had her put in braces and finished it up for her. But while they were away, it looked good. It stayed there. So we'll see what happens. This is the smile, and there's the young lady, and we've got the vertical height. Everything is worked out, and I don't think we even needed to. There's a few flaws, and they're not exactly perfect, but the teeth look good. And here is the little girl when we started it. So there's several years went by before you get through with it. Now you have to figure out how you're going to charge somebody. If you're going to take control of that case, you should have a fee that will cover your expense and give you some profit in there. So I'm going to hush and go on, but I hope this will go anywhere. I mean, you can do this if you're out in the middle of nowhere. I've done some of this on people in Africa where we had nobody else to go to, and you could get the teeth to come in. But I couldn't stay there. I wouldn't stay there long enough to go through with it. All right, we're going to close out, and I hope you'll subscribe to our channel. We've got a lot of people there, and it's hard to think about straightening teeth when so much conflict and trouble is going on in this world right now, and you don't think about getting your teeth straight if you're thinking about just surviving this. And I'm sorry for what's taking place today, and I hope that people will come to their senses and let's stop this killing of people. Thank you again for watching, and subscribe to my station if you will. So I'll close this out if I can get over here and stop.